Tonight, an effort is moving forward to find healthcare solutions and ease regulations impacting people who need hospital care in rural counties. Atlanta News First reporter Abby Kasuras explains why this major policy change is still so divisive.
It's a big bill, 41 pages, and state senators are still making changes. It would increase tax breaks for rural hospitals and expand who would qualify. State lawmakers are hoping this will encourage hospitals to build and expand in rural Georgia.
One thing is clear is that we have to make a change. These current laws are not working.
Roughly a quarter of Georgians live in rural counties. 9 rural hospitals have closed here in Georgia since 2010. Our state is third in the nation for the most closures.
And we're trying to facilitate that. That's part of the problem. We don't want rural hospitals to close. And where we've had them closed, we want to encourage them to reopen.
A Senate committee headed by Republican State Senator Bill Cowser making changes to House Bill 1339, which revises the state's Certificate of Need statute. Certificate of Need is the regulatory system that determines if a new or expanded healthcare provider is needed. The bill passed through the House with bipartisan support.
We were hopeful that we were moving in the right direction with the House substitute, and I think there are still some really great things within this bill. However, we do have some concerns with some.
Anna Adams with the Georgia Hospital Association encouraging the senators to change it again, making enforcement and wording clearer. Jacqueline Harn with Americans for Prosperity says their group would rather see a full repeal of Certificate of Need.
But we believe this is a good step forward that would allow more patients to receive the care that they do need.
Monty Veazey with the Georgia Alliance of Community Hospitals feels more should be done.
The short of Medicaid expansion, I do not know. These hospitals need cash flow.
And just flipping through this bill, you'll see a lot of words crossed out, which means it will need another vote again in the House. The House Speaker and the Minority Leader all signed on as a sponsor for the original piece of legislation, meaning it's a very important bill for both parties. In Atlanta, I'm Abby Kasuras.